On this week's episode of Uncomfortable Conversations,
I want to talk to you.
Not now, later.
No, now.
we speak to medical professionals about the epidemic.
Don't talk to me about a land of the free and the home of the brave until everybody's free.
This week's host is so sick. This is Uncomfortable Conversations.
Well, for Pete's sake, say yes or no.
All right, we're live. You ready?
I'm ready. I was born ready.
All right. Well, this is Uncomfortable Conversations. I am your host, So Sick. Today we have a very special guest. We have medical professional Tiffany Lightfoot. I'm not sure what your exact title is. I know you've been a nurse. I know you worked as emergency responder. So what exactly what do you do now?
I do a couple of things now. I'm still a registered nurse, and I used to be a paramedic. I used to be on the ambulance. Yeah, one of those ones. I was on the ground ambulance when I flew. Now I primarily work in policy. So like I work for the State Department of Health, and I also work in telemedicine and connecting access. Everything's about access. You know, everyone needs a doctor, and it's hard to get to a doctor. So telemedicine is how we're going to, level the playing field.
Okay.
So that's what I do.
Cool. So we brought you on the episode because we want to talk specifically about coronavirus, COVID-19, in the epidemic. You are out there in Hawaii. I've seen just all kinds of stories about Hawaii, especially people, still going, in their to travel, and they might not be aware of how strict the rules might be. We'll get into that a little later. I want to start off, ask you, what's something that you wish people who are COVID deniers and specifically anti-maskers, what do you wish they would realize about the American healthcare system?
I think people really trust the American healthcare system. On one hand, that feels really good. It feels good to have people trust me as a nurse or at the time as a paramedic. But if we don't take responsibility for our own health, there's only so much the doctors and the nurses can do to bring you back. And I think that's really what's fueling a lot of this freedom movement, because I think that's what's really happening. People take this as, I'm in America, I'm free, you can't tell me to wear a mask, and if anything goes down, this is the best healthcare in the world, so these people can fix me. And that is the one thing I wish folks will know is, yes, American healthcare is fantastic. It is incredibly advanced, but it is not perfect. And we can only resurrect so many folks from the hands of death. And so we all need to join and, take a little bit of responsibility and ask ourselves, what do you want for the rest of your life? Are you willing to die by yourself on a ventilator for the last 3 weeks of your life, never seeing your loved ones ever again? And if you're willing to do that, okay. And then the next question is, are you willing to have your grandma do that?
Wow. Yeah, that's real. I could respect that for sure. And do you think, I know this question wasn't on the list. I know you're a prep person, but do you think if we had universal health care, anything would be different with what we're experiencing here in America in the epidemic?
I think a lot of things could be different in U.S. Healthcare if we change the economic model. And some folks look at Canada, some folks look at countries across in Europe. Here's the crazy thing, is in America, this is the most expensive healthcare, nearly the most expensive in the world per capita. But if you look at our complication rate, you're very high risk of dying in a U.S. hospital. And like, I kind of feel grim saying that, but this is statistics. Like, I can't exactly make that up, which we can go into a statistical conversation about how numbers lie, because all numbers lie and all numbers tell the truth. But it's expensive here, and as great of a job as we're doing, some countries are really outperforming the US on how they save lives. So I think a million things can change besides the economics of US healthcare.
And I would assume like that wouldn't affect the capacity issues, because universal healthcare is not going to make the hospital bigger, but we see this trend of all the ICUs reaching capacity and people having to give up beds. People are waiting in the waiting room, bleeding to death because all the beds are taken. So living on a major island in a major travel destination, I read a report or an article about, okay, people still going through with their, resorts, and they're sneaking off into the beach and they're getting arrested and fined. What is something to consider for people who still might be planning to go through their travel plans during the pandemic?
So immediately, like if you're planning to travel within the next month, one thing you can promise is you are going to pay a decent amount of money, probably fly no less than 6 hours to look at the four walls that is your hotel room. So, I mean, come on over. I really hope you really love that hotel or wherever you're staying, because the law enforcement is serious. You can try to sneak out to the beach, and likely you're going to get caught. And we've also seen, unfortunately, I can't say it's unfortunate, but we're having the grassroots. Folks are regulating, saying, I know you're not from here. Get off of our island, which, is a little bit sad because we always like to see the spirit of aloha, but you're really seeing the community protect the land. And so, right now it's kind of like just not worth it unless you want to kick it in a hotel. What we are going to see as of today, the governor is approving a bypass, meaning on September 1st, if you take a COVID test and it's negative within 3 days of your travel, you can bypass that 14-day quarantine. But everyone is hurry up and wait, because if we continue to see the surges, I don't know if anybody, if that September 1st is going to stay, because initially it was August 1st. So I would say just be thoughtful. What do you really want? If you want to bend the rules, it's likely not going to be to your advantage in Hawaii. And, why waste the money and, all the headache? And we want you to have a good experience. So maybe just like wait a little bit.
Yeah. Have you noticed the difference? Are the beaches more secluded now? Are the businesses like what's it like over there right now?
You want to know what's so crazy? Okay, so initially the beaches were empty, and so we all went on lockdown. We're staying in our house for it was a little more than 2 weeks. So we did our 14-day, but it got extended. And when we went back to the beach, I'm like, this water's more blue. And I don't know if you've seen some of the articles where you can see the Himalayas from India, Los Angeles, all of a sudden the skyline's clear. And in Hawaii, I thought it was a beautiful natural habitat that was relatively unadulterated. And even in those few weeks, you saw the land heal itself. The water was more clear, it was more blue, less trash on the beach, less people. And then now, that was in the beginning of the pandemic. Now, with folks out of work, the beaches are busier, but it's our neighbors. It's just folks who live here, and it's a real interesting experience. I'll tell you, I'm happy to be stuck here. I feel like I have Hawaii to myself, and so I feel a little. I feel a little selfish, but it is really lovely to be able to see this in very special time.
Wow. I've heard that, I don't know if it's a quote or a phrase, I don't know how to package it, but I've heard critical thinkers say that humans are the virus to Earth. Since we've been here, we've just been destroying stuff, polluting the ocean, polluting the air, chopping down the trees, and sometimes, okay, we see hurricanes, we see tsunamis, all these crazy natural disasters, that's wiping out populations. But I'm like, we're building against it, but maybe the earth, just like if you stamp in a step in an ant pile, you're going to be dusting those ants off, right? I kind of
Right.
think of it the same way. If earth is alive and it is in its way an organism in its own, that's kind of what I thought about when this got really, really big. I'm like, okay, it's trying to wipe us out now, or some population control to before it's too late, because we're already getting close. I feel like maybe the earth knows that somehow.
Yeah, so I've always thought that, definitely I do not feel our current practices are sustainable. I think a lot of that it had, even prior to the pandemic was coming up, folks were like, the local food systems teach people to garden, these small economies. Now the reality is like, whoa, we for real need that. So I think there's more of a surge. But what I've seen with my own eyes, even in Hawaii, I'm like, yeah, that is for real. You kind of can't deny it. We were leaning on Earth a little heavy. Not to say that the earth couldn't support that. And I don't know if we're overpopulated. I think that's a pretty, intense conversation, but, because I think the earth is strong, and I also think we're strong. I think we're way stronger than what we give ourselves credit, and the earth is just the same. But yeah, we've been leaning on each other, and the earth kind of hard. And I think this was a moment for us to kind of like back up a little bit,
Yeah, kind of get our priorities in order. And kind of sometimes you gotta take everything away to appreciate, what we have. How has your normal job duties been affected by the epidemic?
So I guess it depends on all of our own social media feeds, but for many of us in healthcare, I'm sure other industries too, there is like memes of like someone trying to drink from a fire hose, and it's like processing the 30th new or 300th new policy, in the last 7 days, right? We're just flooded with, this is how you have to do. Oh wait, no, the next day you have 5 new policies. And so being on that policy side of things, like we kind of joke, we're like, oh, it's a drinking game, for every new policy that comes out, and you're hammered. It has been a really heavy sensory information overload, accompanied with a ton of fear of wanting to protect not only the responders and like the doctors, nurses, paramedics, all essential services of postal, food workers, those in the travel industry that don't get a chance to sit down, with like, whoa, people are suffering economically. Some folks are sitting at home. Not only, I think the uncertainty is what really is hurting people now. And how do we balance that for the vulnerable populations that we need to protect? So it's a hot load of a lot of information, competing priorities, not knowing if you're making the right call, and everyone's going to be mad at you no matter what. Which I guess that was actually normal in my job. So I'm used to that side of things, because you just can't please everybody. And, but I think this was an immediate call to action is we had to communicate clearly, accurately, often. And that's the only way we're really going to survive this, because we have to continue to communicate and connect. I think the isolation is just as much as the virus as everything else that we talked about. So lots of changes, but I think we're in a spot where we're going to get through it.
So you say, what does that look like? How do we get through this? What's the other end of the mountain for us?
I think we have to take a moment and ask, what do we want for our lives? I think we're mourning, there was a great article out of the Harvard Business Review talking about that uncomfortable feeling that you're experiencing is grief. Right now, we're watching a world grieving. We're grieving the norm that we have lost. The norm that we've always known is no longer here. Now, maybe we didn't like that norm, because there's a hot load of folks who aren't working, making more money on unemployment than they ever saw from an employer that maybe wasn't treating them respected in a loving way. But they're still mourning of interacting, within that normalcy. And so I think that this is a moment for us to ask, what is meaningful to us? What do we want? Do we want to connect with family or friends? Do I want to be able to be self-sustained? Do I want to learn how to garden so I'm not, at the mercy of these vulnerable food systems? What makes me happy? And I think that's what we have to ask ourselves right now.
Do you think there's how many cases, or what does the curve look like for us to, or maybe the nation, to feel like, okay, we could start opening up businesses? Because here in Texas, we tried that. We're gonna be the pioneers of making mistakes. Everything is bigger, even the mistakes in Texas. And we are paying for it big time, and they might lock it down again. We could have been done by now, but they got greedy. I've heard some scary predictions out there saying, hey, it might take 2 years, before there's a Lollapalooza again, or we're going to Coachella or big NFL games and stuff like that. That's going to impact everything. And I know business runs everything, but it's hard for me to picture, okay, what is the end, or when can we start pumping off the brakes on that?
Yeah, 2 years, I would say, would be at the earliest.
Earliest?
COVID is not going to go away. Wow. What we do see, this is what my physicians are reporting to me, is that the disease is already mutating. So as the scientists learn stuff about COVID, they're watching it change already. It's contagious like the common cold. I mean, imagine a world without the common cold. We wouldn't have that conversation, right? Mm-hmm. And so, I'm glad I brought up that grieving thing, is because like what I hear in your question is, when are things going to be normal again? You're asking for, when's life going to be like life 6 months ago? It will never be like 6 months ago. And that's why we have to redefine, what do we want the next 6 months to look like? What do we want the next 6 years to look like? Are we ever going to get together for a concert? And yeah, okay, there's going to be a concert. Whether it's folks rebelling against public health agencies or not, we're going to get some live music. At what cost? The war on drugs didn't stop people from doing drugs. So, what I mean? Yeah. As humans, we're going to adapt. But the real conversation is like looking forward versus looking behind. And I think it's human nature for us to talk like that. Like, when are we going to get back to our normal? And I think the big challenge is we just need to redefine it. And so then also what I hear in your question is, when are we going to get mobile again? When can we connect and interact and kind of have that in-person energy? Because that's what these concerts and these sporting events give us, right? We get flooded with that energy, and we get rejuvenated to go back to our lives of working late hours and writing policy that doesn't seem as glamorous as Lollapalooza. And I think we're going to find new ways to like pull that energy, and it'll happen, but it's going to be new. And so this is the time for those of us that are really creative to really shine.
Whew. That was a little gloomy, I ain't gonna lie, but I appreciate the honesty. I was like, man, I hope she say next week, but okay. Oh man, that's terrifying. But you're right though. I think the redefinition of normal is we're gonna have to have that tough conversation or realization sooner or later, because that's just the nature of our reality. And you mentioned like looking forward and redefining things. In the middle of this epidemic, we're going through a huge, I would say this is the second civil rights movement. Like, we haven't seen activation like this when it comes to protests and corporate entities having to bend finally to all these things we've been telling them about for years. So how does a Black woman and a medical professional during this unique time keep it together in all the chaos?
That's a trick question. Because like how I'm standing, I don't know. I'm glad I am. Here's what I can't get my head around. CDC data for Black Americans with non-Hispanic white as the control group can track COVID 5-1. Now, what I can't get my head around is race was a social construct. Someone made it up saying, you're this color, you have these attributes, I'm going to call you this, and I'm going to call this other group that. But now we're looking at real life and death, outside of that obvious covert racism. COVID doesn't know what color we are, and tell me why it's a 5-1 ratio. And that bothers me. And COVID is not the only area that we see that. We see that in hypertension. We do see it in, some of the other, traumatic areas. So, for me, my very small, simple life, I just got to leave the world a little bit better than I find it. I play with my son every evening. I have flipped this backyard where we have our hammock and our garden, and we laugh, and I get down in the dirt and I play with them. And, for me, I look at it as science, and I teach them science, and I teach them, the cool stuff about this world. And I am still trying to find the earth under my feet, because this really is, we can't uncouple the civil rights movement and this pandemic from any of the other rough stuff that's going on in life. And I think we just need to act like we're a raindrop in the ocean and ride the wave and roll with it, because it's rough.
Yeah, I love that. Thank you so much for sharing. What are there any, we've heard all kinds of crazy stuff from the president, from Lysol to hydroxychloroquine, and are there any prescriptions or over-the-counter or vitamins, anything you suggest that we could be doing to as preventative measures to protect ourselves?
Totally. I think everyone wants the silver bullet. I think everyone wants, oh yeah, go take your euthanasia, or, this one pill is going to protect you and create that shield. The honest truth, this is what the science tells us, is you got to get your sleep. And, those that work night shift have always been at higher risk of cancer and heart disease, because it does mess up your circadian rhythm. Yeah, so you got to rest. You have to hydrate. You have to eat your 5 vegetables and fruits. You have to find, how do you digest your stress? You got to ease up on the alcohol. And, in Texas, I know you guys don't have issues with cannabis, but those states that do, maybe, lean off it a little bit, or think about an edible, because our lungs are really tender, and those who smoke are at higher risk of having complications from COVID, amongst all the other stuff that it's likely going to kill you, like heart disease and hypertension, so just be thoughtful. And also maybe just don't stress so much. If you are engaging in a little overindulgence, maybe smile about it and don't worry, because we've all seen, those 100-year-olds saying, I want my cigarette and my Coors Light, and I'm doing all right because I'm not worried about it. So.
You mocking my accent over there?
No.
It sounded like me for a second. That's how I hear myself. I don't know if I sound like that or not, but yeah. Well, I sound like I'm pretty high risk based off of all those things you just said. It sounds like I got a good 9 hours left of life. Okay.
Well, good for you for bringing the good word to folks, so you're leaving the world a better place, so you're okay no matter what.
I'll try. So closing this out, what's the best case scenario after all this, and the worst case scenario, in your opinion, for the nation to heal?
Best case scenario in this moment of pause, we connect with the people we love, and we find that there are things that are silver linings, and that we are seeing some anomalies out there. Car crashes have dropped off, falls have dropped off, appendectomies have dropped off. And you have to ask yourself, well, we know about the car crashes, people aren't on the road, but like, how come people aren't getting appendicitis and getting their appendix taken out? You know, perhaps for some folks, is stress really going down because they're connecting with folks, whoever they're sheltering in place. And so maybe best case scenario is we get a chance to reconnect, and we get a chance to really see what's important to us. And we continue to live that for the rest of our lives. Worst case scenario, we missed that lesson.
Miss Hawaii, everyone. Wow, that was so beautiful. Wow, you just blew me away. Damn. Wow. That's really incredible. Thank you. Oh, yeah. What about for those who live alone that ain't connecting with nobody? When can I get a hug again safely?
Man, I don't know. I'll tell you when I figure out when I do, outside of my 2-year-old, but for real though. So I have embraced the video conference, and, promoting telemedicine. I have a crew that all of 2 people have I ever met in person, and I love them, and it is the crew. And we got to be creative. Nothing is going to replace human touch, and that will come back. And, in real talk, even health departments are promoting immediately. First, we're like, you live by yourself, you stay by yourself, and you're going to survive this pandemic. Now that we're seeing that human touch is so important, you need to expand your COVID crew. You do need that human touch, and you do need to split some people that you want to have time with, that are also physically distancing, that you're going to see routinely, that you can have that interaction with. So expand your COVID crew, but make sure they're not expanding their COVID crew too far, because nothing is going to replace that. And it's about time for us to have those new connections. Just keep them small.
So just make sure we're distancing and have our mask on, right?
No, actually,
Oh.
not even. So,
Okay.
so I think it's easier for us to understand this from a kid's perspective. Children, I have a 2-year-old, has to learn how to, his job right now is to learn how to poop, pee, and play with other kids. He has no other mission. He can't learn a third of his responsibilities if I don't have him around other children. And so now that schools are going back into session, people do I send my kid to school or not? And so state health departments are saying, yes, we do need to send our children to school or daycare, but we need to realize that is their COVID crew, and then that is going to be their bubble, because that interaction is so important. And then we just need to just be sure that that is where that child stays in terms of their interaction. Don't keep going to the park and play with all kind of other kids who make some other germs, because then we can still contain the virus. And what I'm saying is we need to extend that to ourselves as adults. We can keep it smaller, but we have to have that human interaction. And you could take your mask off. If you were to have a boyfriend or a girlfriend or a cousin that lives with you, you're not going to wear your mask with that individual if they're not sick. And so that's what we're saying now, is we do need to extend our COVID crew, because connection is important, because we're here.
Okay, good to know. Let me start swiping immediately. No.
I was going to say, go pick one.
I'm so sorry. Okay. Well, thank you so much for joining the show. Again, this is Tiffany Lightfoot. I'm your host, Sique. This has been Uncomfortable Conversations. Like Tiffany said, make sure you get your COVID crew together. So that's a group of friends that you could trust, that you know where they've been. Don't mix it up too much. You don't necessarily have to have a mask. But if you want to be safe, great. Get your rest. What else? What else am I missing?
Drink your water, eat your vegetables. You know what? Let me bring it back. Your COVID crew, think of it as sex. If you don't trust them, you wrap it up. And if you do, you can have a little more fun.
I love it. Easy enough. Okay.
You know, we get that.
I didn't mean to do that. But, okay.
Hi, I'm Nick Bridwell, the creative director of Uncomfortable Conversations. If you were impacted by this video and you think others could benefit from it, then we just ask that you please like and subscribe to our channel. That way we can bring you more content. Thank you so much for coming back to us, and we wish you the best.